The CDC just closed its U.S. monitoring window on the MV Hondius Andes outbreak, and it did it with a guidance document, not a press release. If you're just catching up, the MV Hondius cluster has been under multi-country follow-up after Andes virus cases were linked to the cruise ship. A Spanish passenger tested positive earlier, and the CDC has held its line. Andes virus isn't new. It's normally found in parts of South America, and the risk to the public, including pandemic risk, remains extremely low.
This is Hantavirus Watch. Today, a CDC document with a date and an author, finally, and I want to read it like a contract. Plus a Spanish passenger who tested positive while already locked in quarantine. First up, what that guidance actually tells a health department to do. If you want to keep up with MV Hondius Andes virus outbreak, tap follow so the next episode lands in your feed.
CDC writes,
on June 21st, all U.S. citizens potentially exposed to hantavirus aboard the MV Hondius cruise ship finished their 42-day monitoring period. No cases of hantavirus disease occurred in the United States as a result of this outbreak. This interim guidance reflects current evidence as of May 14, 2026, and may be updated as new information is available.
The CDC's interim guidance is dated June 22nd, and it's written for health departments, not clinicians, not the public. In plain terms, it's CDC telling U.S. jurisdictions how to handle Hondius-linked exposures. That's a different kind of document from anything else CDC put out this week.
Finally, something with a date and an author. So let's read it like a contract. And right there in the scope, the big update, as of June 21st, all U.S. contacts had finished their 42-day monitoring period. No U.S. cases.
Right. That closes the U.S. side of the Hondius follow-up. 0 cases out of that monitoring window. And CDC grounds that in the biology. Person-to-person Andes transmission is rare, tied to prolonged close contact, with no documented pre-symptomatic spread.
And that no pre-symptomatic transmission line is what makes the monitoring window work. If exposed people aren't infectious before symptoms, then a contact who finishes 42 days clean really is clear. That's why the guidance lets departments stand them down.
It also re-stratifies people who flew with a symptomatic case patient, and it tightens monitoring for high-risk exposures. So CDC is separating someone who shared enclosed ship air from a more incidental contact. That kind of detail was missing before.
When I see headlines with 1 confirmed case, 5 suspected cases, 3 deaths, and then a much longer list of contacts being monitored, what do those categories actually mean? And why are health officials already acting when most cases aren't lab confirmed yet?
Yeah, and in public health, those labels have very specific meanings. A confirmed case means a lab test came back positive. In this outbreak, that's genetic or antibody evidence of Andes virus specifically. Early in the MV Hondius cluster, per the BBC's initial reporting, there was just 1 confirmed case, a British passenger in intensive care in Johannesburg. A suspected case is someone whose symptoms and exposure history line up with the disease. Fever, respiratory distress, a connection to the ship, while the lab work is still pending or inconclusive. That distinction matters a lot. The WHO's 4th disease outbreak news update notes that a previously reported U.S. case, first flagged as inconclusive, was ultimately determined to be negative after more testing. That's why suspected is a holding category, not a verdict. Deaths can happen before confirmation, especially with a fast-moving hemorrhagic or respiratory illness like this, so fatalities can appear alongside an incomplete case count. And the contact list. Passengers and crew across multiple countries, including the Netherlands, Canada, Argentina, and Cape Verde, means people with potential exposure, not people who are all sick. Per the CDC's Health Alert Network advisory issued May 8th, the agency flagged the risk to U.S. clinicians precisely because confirmed case counts can lag exposure by days or weeks.
So if officials act on suspected cases in exposure lists, instead of waiting for lab confirmation, doesn't that risk creating a lot of alarm over people who turn out to be fine?
That tension is real. But with Andes virus, the math pushes toward early action, because unlike most hantavirus strains, Andes is the one strain known to spread person to person, as the UK Health Security Agency's guidance explicitly flags. And with that incubation window, someone who feels fine today could deteriorate rapidly within the week. The Public Health Agency of Canada said in its rapid risk assessment that the situation was actively evolving and risk estimates would need to be revised as new information came in. So suspected case and contact categories are there to buy clinicians and health departments time before the lab results catch up. From Jennifer Lagrassa at CBC News.
A Spanish national in quarantine in a Madrid military hospital, who was among those evacuated from a cruise ship earlier this month, has tested positive for hantavirus, Spain's health ministry said Monday.
Spain's health ministry confirmed it Monday. A second positive among the 14 Spanish nationals evacuated from the Hondius to Tenerife. The patient was already in quarantine at a Madrid military hospital and has now been moved to an isolation unit at Gómez Ulla. And the ministry's own line matters here. They say finding the case inside quarantine does not modify the risk situation for the general population. This is the case category system we talked through earlier, happening in real time. A suspected case becomes confirmed inside the window that was built to catch it.
Okay, but does not modify the risk situation. Unchanged from what? Brian wants the baseline underneath that sentence. They're telling me nothing got worse. I want to know what fine looked like the day before they swabbed this person. And here's what I want to know. Was that quarantine tight enough? Early enough? This is one of 14 in the same evacuation group. If contacts of contacts were ever a thing, the answer lives in when isolation actually started, not in a press line on X.
If you rely on Hantavirus Watch for clear outbreak updates, you might also like Ebola Watch, a daily weekday briefing on the DRC and Uganda Ebola outbreaks, case counts, border tracing, WHO vaccine news, and traveler guidance. Find it wherever you listen to podcasts. We've put links to every story from today's briefing in the show notes, so if you want a closer look, you can follow them there. That's Hantavirus Watch for today. This is a Lantern podcast.